If you've just stepped out of the dental chair, it is completely normal to feel a bit anxious about the road ahead. You might be worried about swelling or wondering how you'll manage your recovery while still enjoying life here in Muscat. Imagine walking along the Mutra Corniche at sunset. The last thing you want is a throbbing ache in your jaw. The good news is that a smooth, painless recovery is entirely within your control. The entire goal of your recovery period comes down to one biological process, shown in this cross-section. It's called osseointegration. This is the vital phase where your jawbone physically grows around and fuses to the new titanium implant post. Everything we do from this moment forward is designed to protect this delicate fusion. To create the perfect healing environment, we rely on the 3-2 rule. 3 days of strict physical rest, followed by 2 weeks on a strictly soft diet. Adhering to this baseline transforms recovery into a deliberate, active process where you control the outcome. Let's break down exactly how to execute this. Step 1 begins the minute you leave your Muscat clinic. Your dentist will have placed a sterile gauze pad over the surgical site. Bite down on it with firm, consistent pressure for 45 to 60 minutes. This acts like a tourniquet and establishes the crucial initial blood clot. Next, do not wait to feel pain. While you are still numb from the local anesthesia, take your first dose of prescribed pain medication. Getting the medication into your system early stops the pain signals from taking hold in the first place. Once you are home, your physical posture matters. As this illustration shows, you need to keep your head elevated above the level of your heart whenever you rest or sleep. Stacking 2 or 3 pillows uses gravity to stop blood from pooling in your face, which significantly reduces morning swelling. To actively fight the fluid buildup, apply the 20-20 ice protocol. Wrap an ice pack in a thin towel and hold it against your cheek for 20 minutes, then remove it for 20 minutes. The cold constricts your blood vessels and minimizes the inflammatory response. Maintain this rigorously for the first 2 days. By the 3rd day, you might look in the mirror and notice your face is more swollen than it was on day 1. Do not panic. Medically speaking, day 3 is when swelling and localized discomfort reach their absolute peak. This is your body's natural healing mechanism at work. Once you pass that day 3 peak, the swelling will begin a steady decline. At this stage, on day 4, stop using ice and switch to applying warm, moist heat to the outside of your face to help your body reabsorb the residual fluid. Keeping a strict regimen of pressure, medication, elevation, and temperature control in these first 48 hours drastically shortens your overall discomfort. Your body requires robust nutrition, specifically vitamins and proteins, to rebuild bone and gum tissue. However, the physical mechanics of chewing can tear stitches and dislodge the blood clot. This makes a strict soft diet mandatory. During the peak swelling phase of days 1 through 3, avoid chewing entirely. Stick to a liquid and puree diet and ensure everything is cool or room temperature. Chilled Laban or a cold blended bowl of Shorbat Ades are excellent local options. As the swelling subsides between days 4 and 14, you enter the fork mashable phase. Look at the safe column on this graphic. Cooled, smoothly blended Harees or soft steamed white fish provide high-quality protein without requiring any dangerous chewing force. You must also strictly avoid heat. Traditional hot beverages like gawa or steaming Karak tea might be daily staples, but consuming them too early will dissolve the blood clot and trigger immediate bleeding at the surgical site. Keep everything cool. Equally dangerous is how you drink your cool liquids. This cutaway illustrates the mechanics of a drinking straw. The suction force creates a vacuum that easily rips the blood clot straight out of the socket. This exposes bone and nerves, leading to a severely painful condition known as dry socket. Never use a straw. By selecting the right textures and avoiding heat and suction, you are mechanically defending the surgical site while giving your body the fuel it needs to recover. Recovering in Muscat also requires adjusting to our local environment. The warm climate naturally elevates your core body temperature and blood pressure, which means you have to manage your physical exertion carefully. If you work in an air-conditioned office environment, you can generally return to your desk within 48 hours. But if your job involves physical labor outdoors in the Muscat heat, you need to take at least 3 to 4 days off. Even everyday errands need to be paused. Avoid carrying heavy bags from the grocery store or doing any heavy lifting. Use delivery apps instead to keep your heart rate and blood pressure perfectly level. This restriction on movement extends to daily prayers. During the first 48 hours, the physical movements of bowing and prostrating must be avoided. It is medically advisable to perform your prayers while seated. The biological reason for this is simple. Dropping your head below the level of your heart rushes blood directly to your face. This sudden vascular pressure causes immediate throbbing pain and significantly increases the risk of a hemorrhage at the implant site. Temporarily modifying your routine and avoiding physical exertion ensures the vascular pressure around your healing bone remains stable and safe. The single biggest cause of early implant failure is bacterial infection. On the day of your surgery, your defense is a completely hands-off approach. Do not brush the surgical area, do not use mouthwash, and absolutely do not spit. Starting on day 2, you will introduce your primary defense, the warm salt water rinse. Mix half a teaspoon of regular salt into a glass of warm water. The physical technique here is vital. Take a sip, gently tilt your head from side to side, and then lean over the sink and let the water passively fall out of your mouth. Do not swish aggressively, and, as the warning shows, do not spit. Spitting creates that dangerous vacuum pressure we discussed earlier. This simple saline solution is highly effective. It creates an isotonic environment, which means it gently draws excess fluid out of your swollen gum tissues while making the area inhospitable to harmful bacteria. Finally, you must completely shield the site from chemical irritants, most notably nicotine. Whether it is cigarettes, vaping, or a shisha at a local cafe, nicotine is a severe vasoconstrictor. It immediately shrinks your blood vessels, cutting off the vital oxygen and nutrients your jawbone desperately needs to heal. By utilizing gentle, passive saltwater rinses and completely eliminating chemical irritants, you create a sterile shield around the surgical site, drastically reducing the risk of bacterial failure. If you successfully apply the 3-2 rule, strictly manage your diet, and implement the infection shield, you will have navigated the most critical phase of your recovery. Your discipline directly creates an optimal biological environment. Beneath the surface, osseointegration is quietly and safely fusing your jawbone to the titanium post, securing your new tooth. As you move past the first week, you can slowly begin to lightly brush the chewing surfaces of the teeth near the implant. Continue to monitor your progress, and if you experience any sudden, returning pain after day 4, contact your clinic. Modifying your diet and routines in Muscat for just a few weeks provides your body with the exact conditions it needs to build a permanent, healthy foundation for a lifetime of confident smiles.